Hi everyone, welcome to my channel. I'm Josie. Today I'm going to do the second part on depression. I had a comment, somebody wanted to know, or they didn't understand what depression was. I'm not sure any of us understand what depression is. But I think we have to be really careful. We all, and even in my research and what I have dealt with, taking care of patients and in my own life, everyone feels down once in a while. Everyone has times when, they're just not up to par. They just don't really feel like getting involved in activities. They just feel blah. So don't confuse that with real depression. And be really careful when you go to your physician if he asks you if you're depressed. Because one of the first things that I have seen is a doctor will want to put you on antidepressants. And let me tell you, I believe in that, but I know there are people who are on antidepressants that really didn't need to be because they had periods of being down. And I've been there. I never took anything, but I was down for about 3 months, and yet I still functioned, I still worked, I still took care of my kids. And everyone is different, so remember, I'm not trying to pass judgment, I'm not trying to tell you what to do, but just be really careful. If you can't get over, actually, 3 months was too long for me to wait, but I managed to get over it. I know my faith in the Lord is what got me through it. But I would say if you're feeling down, after about 3 to 4 weeks, you need to go and talk to your physician. But analyze your life too. What is making you feel down? Is there something that you can change? Is it a job that's making you feel down, or a relationship? If you can change it, then work on that. Well, I'll give you an example, and I've laughed about this for years, and it's really not funny. But when I was working in a nursing home, there was an 89-year-old lady who, had multiple health issues, serious ones. And one of the other nurses came to me one day and she said, "Joe, you think maybe we should call the doctor and see about getting her on antidepressants?" And I had taken care of this patient for quite a long time, and I said, how would you feel? She's 89. She has multiple health issues that are never going to go away. She's not mobile, she's bedridden. Wouldn't you be depressed? Do you think that antidepressant is really going to help her? It's just going to be another med in her body making her feel not so good. So I'm not against medications, but be cautious. Like I said, I know people who they have severe depression, and you need medication or some type of therapy. But just be careful. And the sad part about it is in our society, it's just like people are really afraid to admit that they're depressed. It's like a stigma of, it's not a good thing. And sometimes people who don't understand are very critical, insulting even to the fact, they just think you should get over it. And yeah, it's a negative stigma in society when you even, mention you're depressed, although not as much as when I was young. I think. But we're still a society of being judgmental. I don't think humans will ever get over that, of being just judgmental. But mental illness, true mental illness, is not something that you can just, it's not just mindset that you can tell yourself to get over it. You do need help. I believe now, and please don't be offended, I'm talking about myself. I actually believe that if you believe in the Lord and you give your life to the Lord and you try to do the right things, I think it helps you get through this type of thing. Because, we all make bad choices in life. I've made many, and I'm sure all humans have. And lots of times our bad choices is what actually puts us down and we feel depressed. So, but understanding depression, like I said, there's a big difference between, maybe something in your life is not going the way you've planned it. You had a big disappointment and you're feeling down. That's not true depression. That's normal as a human. We get disappointed. And in real life, we don't live in a fantasy. Things don't always go the way we plan them, the way we expect them. So I think that you will know, though, if, just kind of look around, analyze your life. Why do you feel the way you do? Did somebody disappoint you? Are you going through a divorce, a death, maybe a relationship breakup? It's normal to feel down at that time. That doesn't mean you need medication. And my next video, I will get into the 4 stages of grieving in children. Everyone grieves. Everyone gets down at times. So just, your own body. If you cannot get over this feeling within 3 or 4 weeks, you do need to go see your primary doctor. And then maybe if you need a referral, he or she can find you a good therapist. And remember, as my disclaimer, this is not a substitute for professional therapy. And this is also not for children. And I advise that on this channel that you just do not let your children watch it, because I will be speaking of a lot of serious things, and hopefully there's times when I can speak of really happy things. That I think if you go through all the process of grieving and try to go on with your life, that you do attain an even keel in your life where life is good. Think about the positive things in your life. Even through tragedies, you can always find some little thing. And I know it doesn't help when you can look around and find somebody worse off than you. I mean, it's just a normal thing. And sometimes that doesn't change the way you feel. But look around and see. And you can find a blessing in your life to, if you're just down, you will come through that without needing therapy or medication. But real depression is a mental illness, and it does need therapy and sometimes medication. So hopefully, like I said, it's hard to explain. I don't think any of us really truly, other than it's a mental illness, and that not necessarily just because you feel down that you're depressed. We kind of label it that, like we say, oh, we're depressed, but no, we're really not. It's just you've been disappointed in life. Somebody disappointed you. Somebody lied to you. Maybe you fell in love with someone and you totally gave them your life. and maybe a few months, a few years, several years, you found out that person wasn't the person you thought, and they really disappointed you. You're gonna feel down. No one in their right mind is gonna be just cheerful and happy about it. But sometimes going through those things, you will find out later on that it was the best thing that happened to you, because you found happiness somewhere else, maybe with a much better person. So anyway, I'm going to end this. I kind of went off track here, but it's hard, like I said, to really understand depression, and I don't think anyone really understands it unless they've gone through it or gone through some disappointments. My advice is, if you have a friend or a family member who is severely depressed or even just down, just be there for them. That's the best advice I think anyone can give you. Show them that you care. You don't have to say anything. Just listen. Because sometimes when we open our mouth and say something, we actually make it worse because we don't know what to say. And just like when someone dies, even if they believe in heaven and hell, telling them that that person's in a better place doesn't always make them feel good. We should feel better and knowing that that person's not suffering anymore. But it's hard when you've lost a loved one to have this kind of nonchalant attitude about, well, they're in a better place, because you're hurting inside. The inside of you is crying, and the outside, we're human, and we don't like to lose our loved ones. So there's a lot of reasons for depression or sadness. And like I said, if you need professional therapy, go out and find it. And don't worry about what other people think. You take care of your body. Everyone has great advice, and that's why I want to be really careful. I'm trying to give you ideas. I'm not trying to tell you what to do, how to handle your life. I'm trying to give you some ideas, because I'm different than you, you're different than me. And like, one medication might be great for one person, and it might be a disaster for another. I have read, especially on Facebook, and all people give advice, and someone saying, oh, you should take this medication, it's wonderful, it's helped me. That doesn't mean it's going to help the other person. And maybe the other person might even have an allergic reaction to it. So be careful when you give, advice like that. Just listen, just be there for that person who's down. And if they ask you for advice, then you can offer advice, but I would say the best advice is to encourage them to go and get professional help. That's really important, because, like I said, we get our personal feelings in, and there's, like with myself, there's a lot of medications I can't take. They make me very ill, and the only medication I take is thyroid medication and vitamins. So I will, I didn't mean for this to go as long as it's going, but my advice, like I said, is if you really feel like you're depressed and you can't get over this, please, please call your primary doctor. Get some professional help. And I know one lady who's watched my videos who is now she's getting professional help, and she has her good days and her bad days, but it's helping. It really is helping. So it's important that you get help. Like I said, sometimes if you have a family member who is very trusted and you have confidence in them, that is really good. But sometimes we get our personal feelings in our advice. We think what we did is right and it's going to be right for everyone, but that's not true. Everyone's different. So anyway, I'm going to close this, and hopefully you continue watching, and God bless you. Bye, everyone.